Hey, good morning, everyone. As mentioned, my name is Julie Wong. I am the Education and Regional Support Lead at the Alzheimer's Society of Toronto. It is my pleasure to work with my colleagues at UHN to bring for you these webinars for family caregivers on a variety of topics. I did want to do a little bit of housekeeping before I introduce the fantastic speaker. So these webinars are being recorded and they will be available on both the Alzheimer's Society of Toronto YouTube channel as well as the UHN website as well. And for your information, we have recorded all of our previous collaborations and the presentation. So if you do go to our YouTube channel, you will be able to see not only this presentation, but also all of our previous presentations. Okay. The other thing is you're more than welcome to post your questions throughout in the chat throughout the presentation, and we will try to get to as many as possible at the end. So without further ado, I am going to introduce our speaker today. So our speaker today is Dr. Tartaglia. Dr. Tartaglia is a cognitive neurologist at the UHN Memory Clinic, where she sees patients with neurodegenerative diseases and those with concussions who have persisting symptoms. So please join me in welcoming Dr. Tartaglia.
I'm muted. Okay. Hi. Hello, everybody. Thank you for joining us today. So I'm going to talk to you about concussion, mild traumatic brain injury, and dementia. Concussion makes it into the news a lot these days. And there's, I think a really growing interest in concussion and some awareness of it and about the repercussions and implications and long-term consequences. So we'll just go over what is kind of known and unknown about concussion. Oops. So these are my disclosures. So what is a concussion, or also known as mild traumatic brain injury? And I have to just say that although these terms are used interchangeably, they actually are not identical. But for the purpose of this talk, we will use them interchangeably. But, you want to think of a concussion as a milder form of a mild traumatic brain injury. And it's important to differentiate these from a moderate or severe traumatic brain injury, where, those things happen to the brain. There's bruising, there's bleeding, there's tearing. A concussion or mild traumatic brain injury has been defined as, basically something happens. It could be a hit to the head or not. It could be sometimes a hit to the body that the force is transmitted to the brain. And then there's a change in the person. And, the way we define it is that, if we did this Glasgow Coma scale, which is, kind of what people sometimes use when there's a traumatic brain injury, you have to be pretty normal. Okay, so 15 is you and me. 13 is, maybe slightly off, but you have to be doing quite well even at 30 minutes after the injury. You can have loss of consciousness, but it has to last less than 30 minutes. You could have some amnesia, some memory issues related to it, but again, has to be less than 24 hours. And we expect that there would be some impaired mental status at the time of the accident. You could be a bit confused or disoriented. Whatever neurological problem there is going to be transient. And like I said, this is very different from what happens in a moderate or severe traumatic brain injury. And so, I think it's really important to remember, because I think people sometimes get confused with this, is the hit does not have to be to the head. You can sustain a concussion from a whiplash injury, or a fall where you don't actually even hit your head, but you even like maybe fracture your hip, and the force felt by your brain is so great that that you end up with a concussion. And I think it's important to remember that, because a lot of times, especially when there are other injuries, concussions really go undetected. And so, how common is a concussion? Well, it's very, very common. It's a growing epidemic, we call it. We obviously have always focused on sports, but, there's lots of concussions from in the military, from falls, from abuse. Of course, with the increase in awareness, obviously there's going to be a greater number. But, a recent study here actually showed that it's close to 100, there are 150,000 concussions in Ontario per year that actually interact with the medical system. So you could imagine that there's a lot of times that people maybe suffered a concussion where it was unrecognized, or they didn't seek, medical care because, they got better after a few days. But in terms of documented healthcare interactions related to concussion, it's about 150,000 per year. And, the problem with concussion is that it's a clinical diagnosis, and so there are no diagnostic tests. Every now and then you'll hear that there's some, new marker, but actually there are no diagnostic tests for concussion. It really is some healthcare provider, usually a physician, nurse practitioner, psychologist, who, asks you after you report some event where you feel like maybe you had your bell rung, or you feel like, yeah, I've suffered a concussion, where somebody asks you certain questions and then they diagnose you with concussion or not. And it's very heterogeneous. So, when we say that we've seen one concussion patient, well, you've seen one concussion patient, because really no two people suffer the same injury after a head injury. And like I've said, even though sometimes we do an MRI, we usually do only a CT scan when people have a severe enough fall or they report certain symptoms. But the CT scan won't pick up anything in a concussion usually. If the CT scan picks something up, it means that it's more than a concussion. And the same is true for an MRI. Usually the MRIs are completely normal, although we do find now and then that people will have a little bit of blood. Okay. And, what are the symptoms after a concussion? Well, you can see just like cursory perusal that there's many different types of symptoms. Some are cognitive. So people can complain that they feel slow, they can't remember, they have brain fog, they feel confused, can't concentrate. There's some that are physical, headache, tinnitus, that's the ringing in the ears, blurred vision, dizziness, balance problems, fatigue. And then there are the personality, mood issues. People can become irritable. Sometimes people become over emotional or anxious. They have trouble sleeping, and they can't get to sleep. So you can see that, when we're asking people what's happened to them after a concussion, you have all these different types of symptoms, and the different combinations come together. And so when we're really thinking about the person in front of us, we really kind of have to think about, well, what symptoms are they suffering from? Because when we list them all, there are almost 50 different symptoms that people complain about after a concussion. And what about the recovery? So luckily, with the thousands and thousands and millions of people across the world having concussions, usually people recover. So 85 to 90% of people are thought to recover. This was, however, when concussion was allowed to take 3 months to recover. The recent guidelines tell us that if a person hasn't recovered in about 2 weeks in an adult and 4 weeks in a child, we should think of this as persisting symptoms, okay? And we expect that the neuropsychological function should be back to normal in 5 days. And that, if they have any injury that turns into a neurological problem, it really has to be transient. We really do not want to see focal signs. So, if somebody has something that doesn't work properly after a concussion, then, that's a real reason to seek medical attention quickly, because we do not expect that after a concussion. And what about this persisting symptoms or prolonged symptoms of concussion? So this is the term we give when there's a failure of normal recovery. We expect, like I said, recovery in less than 10 to 14 days in adults, 4 weeks in children. And as I already mentioned, this definition used to be that it could take you up to 3 months to recover. So obviously now when we think of the number of people who have persisting symptoms, well, the number goes up dramatically, and it's all because we've changed the definition. Okay. And that's because we still don't understand what happens to the brain when you have a concussion, but it's a brain injury. So something happens, we just don't have a way to detect it right now. And so when people have persisting symptoms, we don't actually presume an underlying cause because we actually don't know what the cause is. So we take an approach where we focus on the symptoms, regardless of the cause, and try to help the person get better. And so when we're thinking about the number of people that have persisting symptoms, it actually is pretty high. In some studies, it's like 10%, but sometimes it's up to almost 60%, and that's within the 3 months. So with these new guidelines that brought it down to 1 month, we expect that it's going to be even more, which means that, when you think of 15%, just kind of, probably a low estimate of 150,000 people a year, it's a lot of people just in Ontario alone enduring prolonged symptoms. And what are these prolonged symptoms? Well, I think you can see that many of them, they look just like the acute symptoms. So, could be prolonged headache. And I'm talking about, people having a daily headache for like 6 months, a year. They can feel unsteady, blurred vision, sensitive to light and sound, ringing in the ears. They could have cognitive problems, complaining about attention, concentration, and memory problems, feeling slow. They can also have psychiatric or behavioral changes. And so it's really actually not uncommon for people to complain about, some neuropsychiatric symptoms like depression or anxiety or even post-traumatic stress disorder after a concussion. And so when we think about how we're going to treat people, we try to impress upon them that there's this vicious cycle of concussion. And so the injury happens, it does something to your brain. But the problem is that the symptoms that you end up with as a result of the concussion actually aggravate other symptoms. So, for example, let's say you have a daily headache. Well, a daily headache means that you can't concentrate as well as you used to. Maybe you can't, sleep as well as you used to. Maybe you're upset, you're depressed about this headache, you're anxious about the headache. And of course, that makes your cognition even worse. And then you get anxious about that, and that makes you register even less. And so, you could imagine how all these symptoms are working together against you. And so we really feel like, yes, we have to target the symptoms individually, because sometimes just making a little dent in one symptom actually has exponential benefits. And, I can't impress upon enough that the rates of neuropsychiatric symptoms following concussion is super, super high. It's incredible how often I have patients who don't recognize, or it wasn't recognized by anybody, that, their depression, their mood changes, their anxiety is all a consequence of their concussion and really needs to be addressed. More concussions you have, the higher the risk. And of course, you can have both depression and anxiety, or post-traumatic stress disorder and anxiety. There are comorbid conditions, so substance abuse, we see. And of course, if you already have a psychiatric problem, well, it can be made worse because of your concussion. And so when we are thinking of people who have a concussion, we have to keep in mind that, the concussion doesn't happen, on a blank slate, right? It happens on you, which is you're a landscape, and this landscape has medical factors that could be pre-existing, physical limitations, or pre-existing neurological or psychiatric problems, or, you have pain. It could be that you're taking medications or you're given medications. And so, it's important to think about that. As well, when we look at the number of symptoms that a person has, and I've already said it could be like 50 different symptoms, we have to remember that, it could be a big problem to try to address each one individually to be able to, help the person. We have to think about contextual factors. So when people have an injury, their background includes things like their finances, includes their level of education, includes their age, includes their gender, includes their, resiliency factor. A lot of things have to be taken into consideration, and that your outcome will be impacted by that. If you have a work-related injury where you have access to some resources for, physiotherapy and occupational therapy, well, that will be helpful. But think of if you fall on a sidewalk and you may be off work because of that. You may not have access to any resources, and that could, aggravate the situation. And so, I always think of and tell people that, when they have a concussion, it's almost like it makes some of the gears in their brain stop. And so many gears stop because they're all subserving all these different symptoms that they have. And so sometimes when we get one of the gears going, we can entrain the other ones to get a much better outcome. Because, at the end of the day, we know that getting people back to their work, to their school, getting people back to their activities, physical activity, cognitive activity is the best thing for recovery. And so, what do? We actually target all the different symptoms. I do think that targeting mood is very, very important. And so we will, try cognitive behavioral therapy. We will try antidepressants. Headache, a daily headache in somebody, especially somebody who has never suffered headaches. Headache sufferers kind of know that, they're not going to have a good day because they have a headache that day. But people who develop new onset headache after a brain injury, it is so upsetting to them. It's a lot of times constant headaches, fluctuates, but, can be kind of mild, but still there, or 10 on 10. And so when people have a headache for a few weeks, we often will start treating it to prevent the headache. Sleep apnea, big problem, undiagnosed in many people. This is, really not good for the brain. But on top of that, sometimes when people have a concussion, they stop doing all their activities, they put on some weight. Increased weight is a risk factor for sleep apnea. And so, if you don't treat the sleep apnea, you're definitely going to have trouble getting better. If people have dizziness, balance problems, we send them for vestibular physiotherapy. Low impact exercise. If I could bottle this, I would be a gazillionaire, because it's so important for your brain to get some physical activity. And we mean aerobic exercise. So cardio, that means, it's got to be stationary bicycle or swimming or elliptical, but things that, don't thump your, give you this like sensation that is like going through your head, like running. Sometimes people love running, but when they get a concussion, they can't run anymore, because every time they thump, their foot on the ground, they feel like they feel it in their head. But it's not everybody. And then, we want people going back to work, to school, to play. And so we have guidelines for getting them back with these modified and accommodations. What about the delayed effects of concussion? There's an increasing awareness that concussions can be associated with dementia. So until not that long ago, everybody knew if you had a moderate or severe brain injury, that this could be associated with dementia later on in life. But more recently, it's been recognized, and this is as of 2020, that even a single concussion would increase your risk. Now, obviously, when we think of ourselves, I can't imagine too many people who have never had a concussion. It's, most of the times we wouldn't even know, because as children, we sometimes fell, and some of us fell pretty hard, and, recovered. So I think the important thing to think about is when you hear that something is a risk, and that, it's kind of like you put something into your bad basket, that you probably want to work extra hard at doing activities that mitigate that risk, put a lot of things in the good baskets, and we'll go over that. But this data was actually based on very large studies that showed that, one concussion could increase your risk very mildly, but it did. But multiple concussions obviously increase the risk even more. And so, it's really important to think about this. And, obviously in people who have the possibility to avoid, concussions, like some sports, let's say, that we want to, we want to think about that. This is, this infographic that is really related to these, identified 12, these identified risk factors for dementia. There's 12 of them that have now been identified. There used to be 9, and 3 of them were added in 2020. And if you look, the one that's been circled is head injury. But if you look at the list, you can see that there's other ones there, like air pollution. How can we do anything about that? Infrequent social contact, so I think the thing to remember is there are things that we actually do have a control over, right? Physical inactivity, number 1. So we know that not exercising is really bad for the brain. And so, including aerobic cardio in our daily activities is super important, and has a lot of evidence that this can delay neurodegeneration, it can delay dementia, and it can slow it down. Avoiding smoking, avoiding excessive alcohol consumption. You may or may not be aware that the recent guidelines basically says that anything above 2 glasses of alcohol per week is increased with risk of harm. And so it's really important to, think about that, because those guidelines really talked about, cancers and, big concern about that. But, we do know that alcohol actually has a toxic effect on the brain. And so to think about that, social isolation is bad for the brain. And so making sure that you can stay socially connected and join activities where you could interact with other people, avoiding obesity, getting the hearing aids if you have a hearing impairment. Hearing impairment is bad for the brain. Depression is one that keeps getting highlighted. We don't know whether late life depression is actually a risk of dementia, or it actually is kind of the start of somebody's dementia. Making sure your diabetes and your high blood pressure are controlled, and then educating oneself. We know that education is very protective of the brain. It gives you cognitive reserve. And we know that actually that's not only when you're young, it's lifelong education. So the other thing that people think about, and this is the one entity that people think about most when they think about concussion, that's because it's made it into the news a lot. This is chronic traumatic encephalopathy. This has been described in former professional athletes, whether they be hockey players, football players, boxers. It's thought to be triggered by these repetitive mild traumatic brain injuries that include concussive and subconcussive blows, and it seems to evolve over decades. And like I said, it was first described in boxers, but now it's been observed in other sports as well as the military. And the symptoms of chronic traumatic encephalopathy kind of overlap some of the ones that we see in concussion, but most of them are kind an extreme. We see a lot of changes in behavior, some, lots of psychiatric, where can be impulse control, there can be aggression and severe mood disturbance. There can be significant cognitive impairment to the point of being demented, and then some motor deficits. The challenge is, of course, when somebody is, in front of us who has suffered multiple concussions, and is, we have a lot of people who've maybe had one concussion in their lives or a few and are worried about CTE. But the symptoms that they describe, they overlap with many other things. They overlap with concussion, with persisting symptoms of concussion, as well as other neurodegenerative diseases like Alzheimer's disease or frontotemporal dementia. So, I often tell people there was this really beautiful study done and that looked at 310 people who had generously donated their brains after their death. And they did not find one case of CTE in all of these people. Okay, even in the ones that had some traumatic brain injury. And so we really think this is something that happens when, these former athletes are having so many, even like subconcussive blows to the head, that it's what ends up with, resulting in CTE. This was another one, large brain bank, 4,700 brains. They only found 21 cases in CTE, and it was only amongst the 66 former athletes. So, this is not something that we really need to think about so much, but in terms of its risk for dementia, for Parkinson's, this is a large study that was done actually in Manitoba using, administrative databases. So this is data that's collected through the healthcare system. And it compared actually about 50,000 people in the concussion group to 150,000 in the control group, so no concussion. And they were basically looking at dementia, attention deficit disorder, Parkinson's disease, as well as mood disorder. And they did see that that even a single concussion in somebody's lifetime could increase the risk of being diagnosed with Parkinson's disease, by dementia, attention deficit disorder, and some mood and anxiety disorders. So, and if you had multiple concussions, obviously this increased the risk even more. So, I think it's really important to think about, protecting our brains. I always tell people it's, when we think of ourselves, we don't apply the same rules as we do to our houses and our cars. And, if we didn't take care of our houses, we would be living in shacks. And if we didn't take care of our cars, they would just fall apart. But people don't have the same attitude towards their bodies and their brains. And so, we have to think about that. We have to be proactive about doing things that are good for the brains, because stuff happens, even you're walking along and you slip and fall, and you can end up with a concussion. There's, the evidence for its association with Parkinson's disease is actually quite good. Obviously these are large studies, and when we say something increases your risk, that's not the same thing as saying you will get this, right? Increasing your risk means that, this is kind of tilting you towards towards that condition. And so you got to work extra hard to, tilt yourself away from that. A lot of the studies that were done, I have to say, didn't differentiate between mild or moderate or severe traumatic brain injury. So, there's still some unknowns here. But I think, the data between head injury and Lewy body disease, or that's what Robin Williams had, and Parkinson's disease is kind of becoming more solid. There's also some data, like I said, in Alzheimer's, and also other types of dementia. So frontotemporal dementia, also in ALS. Now, I'm going to switch gears because I want to talk about concussion in the elderly. So, until now we're talking about people getting a concussion, and then, what are the long-term effects? But what about if you're older and you get a concussion? Concussions are very common in older people. All the data and obviously this has to do with public awareness, but, all the data that we're seeing is that there seems to be an increased incidence of concussion. So, in one study, it rose by 61%. In those over 75, it was an increase of 69%. So, of course, as the public awareness has increased, all these activities that we do, we also promote activities, which is great, but, there's some risks that people could end up with concussion. And, a lot of times, we try to see, well, who are the people who are maybe most vulnerable? And in some of these large databases, we see that, female and white were, the people who seem to be at highest risk. Now, that could also be related to the fact that, white women have a very, very long lifespan. And so, and they were the ones that were included in these databases. So, there's a lot of, stuff we still don't know about this, but, so far we think this is a high risk group. And what about, like, what is TBI in the elderly? What are the causes of it, right? So there's many different causes. I would say falls tends to be at the top of the list. There's lots of people end up in the emergency rooms from a fall and suffer a concussion. Motor vehicle accidents, not to be underestimated. 70-year-old and older have the higher accident rate per kilometer driven in than any other age group except for young male drivers. And that's pretty bad. And, it could also be related to aging, right? That can affect vision, can affect cognition, can affect psychomotor skills. Suicide is actually the third leading cause of injury in those above 65, so not to be underestimated. And when they've looked at the risk factors here, they found that white male, past depression, chronic pain, illness, social isolation were risk factors for suicide. And then, of course, not to be ignored, elder abuse. So what is the problem when people are older and have an injury that could result in a mild traumatic brain injury? Well, a frequent problem that is encountered is that the assessment in the acute phase, so at the time, can be very difficult because, first of all, we don't know the status of the person prior to the fall, prior to the injury. And this can be very variable. Like you can take 10 people who are 75 years old and their, cognitive abilities and physical abilities can be very widely different, right? And so, of course, then, it will be difficult to get an assessment. There's a lot of comorbid conditions that are associated with just aging. And so, people who are taking medications for a lot of the age-related conditions, it could be arthritis, it could be high blood pressure, or those kinds of things. But some of those medications can affect your senses, and so you could be not as quick as you used to be. There could be an interaction with these. So when they're asking you questions, maybe you're not understanding as well, because of some pre fall or pre-injury problem, but they're asking you questions and you're getting confused. Sometimes people forget that they've had a fall or an injury, and so it's kind of trying to figure out what happened. Why is somebody changed? And of course, when you have a fall, you're at higher risk of another fall. And so that means you're at higher risk of repeated head injuries. And in older people, because one of the, one of the conditions that affects older people more is this need for a blood thinning. And so atrial fibrillation is a condition that people usually take some blood thinners to treat. And if you fall and your blood is quite thin, that puts you at increased risk of bleeding inside the brain. And that because of the brain changes that occur with aging, it could be a delayed effect. This is just to show you that, when you're younger, you have much less space in the brain. So you see much less black. But when we're older, our brains do shrink. Okay, they start shrink when they're 30s or 40s. And so there's a lot more black where there used to be brain there. And so you could imagine that, if somebody was going to have a bleed in the brain, well, you would probably notice it a lot earlier in a young person, but before it would be picked up in an older person where there would be symptoms, there would be a lot more blood that was lost. And the reason that it's also, at higher risk is on top of the anticoagulation, the blood thinners, is that there's more shrinkage of the brain. There's more, the veins of our brain aren't as good. And so, sometimes when older people fall, we actually are really worried about this. And so a lot of times we are concerned that we can miss the diagnosis in older people, and that, we worry in people if they've had a change in their behaviors, we worry about a urinary tract infection. Well, you could imagine, what kind of effect a concussion might have, where the person can't tell you what's happened, but there's a lot of changes that can happen in their memory, in their thinking, in their, in their ability to function on their own. And so it actually is a big problem when these head injuries are missed. I looked a few years ago, I looked through 300 referrals, and there were less than 1% in those above 65. And so then I looked through 1,000 referrals, and it was still less than 1%. So, when you think of the kinds of activities, the kinds of injuries that older people suffer, you can't really imagine why it would be so low. And, I think, one of the, like I showed you before, that symptoms that are common after concussion are cognitive symptoms. And so you could imagine that, why wouldn't an older person also suffer from some increased cognitive impairment after a traumatic brain injury? And if it was already there, you could imagine that it would be, more severe afterwards. And they could also maybe recover, but at a slower rate. There is some evidence, but it isn't consistent, that older people have worse cognitive outcomes. But some evidence just shows that it takes them a longer time to recover. And of course, as I've already mentioned, if they already had a previous stroke in the past, well, that is going to affect their outcome. And so you really need to know their baseline. And I've already mentioned that, pre-existing, let's say pre-existing stroke or depression could have a tremendous effect on the outcome after a concussion. And that, overall, if people get hospitalized after a traumatic brain injury, older adults usually require extended hospitalizations, and they're more severely disabled once they are discharged. What about neuropsychiatric symptoms in patients who are older? Well, of course, I've already told you that it's super common for people to have neuropsychiatric symptoms after a concussion. So why would older people not also have, a problem with this? And yes, it's very common to have depression, anxiety, irritability, and that, when you look at people who have a concussion versus people who don't, the incidence of depression is like astronomically higher. And so, I think it's important to screen for depression after traumatic brain injury, because it can have, like we already said, in younger people, we expect that they're going to, your mood will interact with your cognitive function. Well, that relationship isn't changed because people are older. And how do you treat that? Well, we need to make the diagnosis first. So that is a problem. And we have to, we always tell healthcare providers and families, you need to look for clues. If people have bruises on them that are unexplained, you find somebody sitting on the floor, there's a change afterwards, maybe they have a headache and they can't even tell you, or there's sleep change, or they, lots of things can happen. The symptoms I described initially also pertain to older people, and so they can change, a person's function. They can change somebody's comportment, and so it's important to think about that, and to have targeted prevention strategies. We looked a few years ago at the causes of injuries and persisting symptoms of concussion, and we could see that there were differences between old and young people. There were differences between men and women, old men versus young men, and old men versus old women. So I think it's really important that we need to target our prevention strategies and make sure that we're, getting the right message to the right person. And what about if you have dementia? Well, of course, we would expect that, somebody with dementia could also get a concussion, and we could expect that things could get worse afterwards. Not always, but they could. And, if a person has dementia and can't tell you that they've had an injury, they can't tell you that they have headaches, or that they feel dizzy, It's sometimes up to us to figure this out, to say, is the person got agitated after we found them on the ground? Did they have a concussion? Maybe, they have a headache and they can't tell you that. And, treating the headache will, is a treatment for their agitation, not giving them some medication to calm them down. And of course, because it goes undiagnosed, these people are at high risk of having multiple concussions. And so to summarize, it's important to remember that concussions are the result of a brain trauma. The symptoms that come about afterwards are related to brain injury, and that the symptoms can be very varied, and they can include memory problems, they can include sleep problems, they can include headache, psychiatric issues, and that persisting symptoms can occur. Luckily, most times, we get better, but there's, a good number of people who have persisting symptoms, and that we need to diagnose it and treat them. And so it becomes important to, look for concussions when they happen, when somebody has an injury that could result. It's very, very, very common for patients who are even cognitively fine to have an injury that caused them a hip fracture, and nobody actually asked them about possible concussion symptoms. And so, they recover from their hip, and, people think, well, of course they broke their hip, so they're miserable, they can't concentrate, they have pain, they have this, they have that. And then, when that's recovered, and the person's not better from, their cognitive mood, a headache, somebody, says, oh, well, maybe they also had a concussion at the time. So it's important to think about that. And, we really treat the persisting symptoms while we look for a cure of concussion. So thank you for listening. And I can take any questions if there are any.